Question 1. A veterinary nurse is assessing a dog that is recovering from surgery. The dog is showing signs of swelling and redness at the surgical site. The nurse also notices the animal is more lethargic than expected and its temperature has risen above the normal range. What should the veterinary nurse's immediate course of action be? A. Increase the dosage of analgesic medication immediately and wait for further developments. B. Observe the animal for a few more hours to see if the signs subside. C. Contact the veterinarian to report the symptoms and prepare the dog for possible infection management. D. Administer an anti-inflammatory drug and schedule a follow-up appointment in a few days. Answer C. Contact the veterinarian to report the symptoms and prepare the dog for possible infection management. Explanation: the signs of swelling, redness, lethargy, and fever could indicate an infection at the surgical site, which is a complication that requires immediate attention. The veterinary nurse should contact the veterinarian promptly to report these symptoms and ensure proper infection management. Early intervention is crucial to prevent further complications. Option A may risk further harm by potentially increasing medication without understanding the underlying cause. Option B is not appropriate as it neglects the potential severity of the situation. Option D might delay the necessary intervention and is inadequate for addressing the possible infection. Question 2. In veterinary practice, which of the following best describes the ethical principle of informed consent? A. Clients must be informed about all aspects of their pet's treatment, including potential risks and benefits, and agree before any procedure is performed. B. A client must provide consent only after the procedure has been completed to avoid any legal implications. C. Informed consent involves the veterinarian providing the treatment without discussing risks to avoid causing unnecessary worry. D. Informed consent is only required when performing surgeries or invasive treatments, not for routine checkups. Answer A. Clients must be informed about all aspects of their pet's treatment, including potential risks and benefits, and agree before any procedure is performed. Explanation: informed consent is a cornerstone of veterinary ethics, ensuring that the client is fully aware of the proposed treatments, including risks and benefits, before giving their consent. This principle is rooted in respecting the autonomy and rights of the client. Option B is incorrect because consent should be obtained before the procedure to avoid ethical and legal issues. Option C violates the ethical standard of transparency and trust in veterinary care. Option D is incorrect because informed consent applies to all treatments and procedures, not just surgeries or invasive procedures. Question 3, scenario-based. Mr. Wilson is the owner of a young male cat who has been diagnosed with feline hypothyroidism. The veterinarian has prescribed medication and recommended dietary changes for his cat. Mr. Wilson is concerned about the potential side effects of the medication and is unsure whether he should proceed with the treatment. As the veterinary nurse, how should you respond to Mr. Wilson's concerns? A. Advise Mr. Wilson to stop the medication immediately and explore alternative treatments without consulting the veterinarian. B. Explain the potential side effects of the medication and assure Mr. Wilson that these can be managed. Offer to provide written information on the treatment. C. Tell Mr. Wilson that he should follow the veterinarian's recommendation without question, as it is the only appropriate treatment option. D. Encourage Mr. Wilson to seek second opinion from another veterinarian before proceeding with the recommended treatment. Answer B. Explain the potential side effects of the medication and assure Mr. Wilson that these can be managed. Offer to provide written information on the treatment. Explanation: as a veterinary nurse, it is crucial to address the owner's concerns with empathy and transparency, explaining the potential side effects and how they can be managed while providing additional written resources ensures the client is well informed and reassured. This builds trust and allows Mr. Wilson to make an informed decision about his pet's treatment. Option is not suitable as it advocates discontinuing the prescribed treatment without proper consultation. Option C dismisses Mr. Wilson's valid concerns and could result in breakdown of trust. Option D, while offering second opinion, might unnecessarily delay treatment and complicate the decision-making process if the current treatment plan is appropriate. Question 4. A veterinary nurse is tasked with taking the medical history of a dog that has come in for a routine checkup. The dog is a 7-year-old Labrador Retriever with a history of joint problems. The owner mentions that the dog has been less active recently and seems to be experiencing difficulty getting up after long periods of rest. The dog also has a history of occasional vomiting and diarrhea. What should the veterinary nurse do first? Case to ensure comprehensive care. A. Start by performing a full clinical examination and document the symptoms for the veterinarian to review. B. Ask the owner about the dog's diet and any recent changes to its routine and proceed with diagnostic tests immediately. C. Perform complete blood, CBC, and urinalysis and schedule an appointment with the veterinarian for further treatment. D. Offer advice to the owner regarding joint supplements and monitor symptoms for the next few weeks. Answer A. Start by performing a full clinical examination and document the symptoms for the veterinarian to review. Explanation. The first step in this scenario is to conduct a full clinical examination to identify any physical signs of the reported symptoms. Documenting the symptoms is crucial for providing accurate information to the veterinarian, who will then make an informed decision about further diagnostic steps. Option B suggests diagnostic tests without first performing a clinical examination, which is not appropriate. Option C prescribes specific tests without a proper clinical evaluation, which may not be necessary at this stage. Option D may delay appropriate care by focusing solely on joint supplements without addressing other potential underlying causes. Question 5. A veterinary nurse is assisting with the anesthesia of a dog undergoing a routine spay. The dog is overweight and has a history of respiratory issues. During the pre-anesthetic assessment, the veterinary nurse notices that the dog's vital signs are slightly elevated and it appears to be having some difficulty breathing. What is the most appropriate action for the veterinary nurse to take before proceeding with anesthesia? A. Administer a sedative to help calm the dog and proceed with the anesthesia. B. Delay the surgery and consult with the veterinarian to determine if additional steps are needed before proceeding with anesthesia. C. Proceed with the anesthesia as planned, as the elevated vital signs are likely a normal response due to stress. D. Increase the dosage of the anesthetic to counter the dog's elevated vital signs and ensure the procedure goes smoothly. Answer. B. Delay the surgery and consult with the veterinarian to determine if additional steps are needed before proceeding with anesthesia. Explanation. Given the dog's history of respiratory issues and the elevated vital signs, it is essential to take extra precautions before proceeding with anesthesia. The veterinary nurse should consult with the veterinarian to assess whether the dog requires any additional monitoring, pre-anesthetic treatments, or adjustments to anesthesia protocol. Option could exacerbate the dog's condition by administering sedative without addressing the underlying issue. Option C overlooks the elevated vital signs, which could indicate potential complication. Option D increases the risk of complications by administering higher anesthetic dose without addressing the dog's health concerns. Question 6. In veterinary practice, which of the following statements best describes the legal and ethical considerations when handling controlled drugs, such as opioids, in a veterinary setting? A. Controlled drugs can be administered without strict documentation if the procedure is routine and the patient is stable. B. Controlled drugs should always be securely stored, accurately documented, and handled according to the relevant legislation to prevent misuse and ensure patient safety. C. Only veterinarians are legally responsible for the administration of controlled drugs. If veterinary nurses are not involved in the documentation, storage. D. It is permissible to use controlled drugs off-label for animals if the veterinarian believes it will benefit the patient as long as the animal is not under anesthesia. Answer. B. Controlled drugs should always be securely stored, accurately documented, and handled according to the relevant legislation to prevent misuse and ensure patient safety. Explanation. Controlled drugs, such as opioids, are subject to strict regulations due to their potential for misuse and abuse. These drugs must be securely stored, carefully documented, and administered in compliance with relevant legislation to protect both the and the veterinary practice. Option. It disregards the need for proper documentation and handling which is legally required. Option C is incorrect because veterinary nurses play an active role in the management of controlled drugs, including their documentation and storage. Option D is also incorrect, as the off-label use of controlled drugs must still adhere to regulatory standards and is not a blanket permission for any use. Question 7. A veterinary nurse is assisting in a surgical procedure on a dog. During the procedure, the animal begins to show signs of hypotension and bradycardia. The veterinary nurse monitors the patient's vital signs and notices a gradual decline in blood pressure and heart rate. What is the most appropriate course of action for the veterinary nurse to take at this point? A. Increase the rate of the intravenous fluids and notify the veterinarian immediately to adjust the anesthesia. B. Administer a vasopressor drug to raise the blood pressure and wait for the veterinarian's instructions. C. Continue with the procedure as planned, as these signs are often temporary during anesthesia. D. Decrease the flow rate of the anesthesia and monitor the patient closely without notifying the veterinarian. Answer A. Increase the rate of the intravenous fluids and notify the veterinarian immediately to adjust the anesthesia. Explanation: hypotension and bradycardia during surgery are serious signs that should be addressed promptly. Increasing the rate of intravenous fluids can help raise the blood pressure, and immediate notification to the veterinarian is essential for determining if adjustments to the anesthesia are necessary. Option B is incorrect because vasopressors should be used only after proper consultation with the veterinarian, and they are not the first line of treatment. Option C is dangerous, as the signs of hypotension and bradycardia should never be ignored, especially during surgery. Option D fails to take appropriate action to address the issue and delays necessary intervention. Question 8. A veterinary nurse is asked to assist with a diagnostic ultrasound procedure on a cat with suspected abdominal tumors. The veterinarian has requested that the ultrasound be performed using the transabdominal approach. As the veterinary nurse, what should you do to ensure optimal imaging quality during the procedure? A. Ensure the cat is fasting for at least 12 hours prior to the ultrasound to minimize food interference and improve image quality. B. Position the cat in a standing position for the duration of the procedure to allow for optimal scanning of the abdominal area. C. Administer a mild sedative to the cat to reduce stress during the procedure, ensuring it remains calm and still. D. Allow the cat to eat normally before the procedure, as food interfere with the ultrasound imaging quality. Answer A. Ensure the cat is fasting for at least 12 hours prior to the ultrasound to minimize food interference and improve image quality. Explanation: fasting prior to an abdominal ultrasound helps to reduce the amount of gas and food within the gastrointestinal tract, which can interfere with the clarity of the images. This is especially important for obtaining optimal imaging when assessing abdominal organs and potential tumors. Option B is incorrect because the cat should be in a comfortable lateral or dorsal recumbency position, not standing, to facilitate a better view of the abdominal organs. Option C, while appropriate in certain cases, may not be necessary for every cat and could affect the imaging if not carefully managed. Option D is incorrect because feeding the cat can cause gastric and intestinal distension, which can reduce image quality during the ultrasound. Question 9. A veterinary nurse is working with a client who has brought in a rabbit for a routine wellness check. The client is concerned about the rabbit's recent weight loss, reduced appetite, and occasional lethargy. After a thorough examination, the veterinary nurse suspects gastrointestinal stasis, a common condition in rabbits. What is the most appropriate initial nursing intervention to support the rabbit's recovery? A. Provide fluids via subcutaneous or intravenous route. Administer oral probiotics and ensure the rabbit has access to high-fiber food. B. Withhold all food and water for 24 hours to allow the gastrointestinal system to rest and recover. C. Immediately start antibiotic therapy to address any potential infections causing the symptoms. D. Administer analgesics and allow the rabbit to rest in its enclosure without further intervention. Answer A. Provide fluids via subcutaneous or intravenous route. Administer oral probiotics and ensure the rabbit has access to high-fiber food. Explanation: gastrointestinal stasis in rabbits is a common condition that can lead to dehydration and further gastrointestinal complications. The most appropriate treatment includes rehydration via fluids, either subcutaneous or intravenous, providing oral probiotics to support gut flow, and ensuring the rabbit has access to high-fiber food to stimulate normal gastrointestinal motility. Option B is harmful because withholding food and water can worsen dehydration and exacerbate the condition. Option C is inappropriate, as antibiotics are not the first line of treatment for gastrointestinal stasis unless there is evidence of infection. Option D neglects to address the core issue, which is the rabbit's gastrointestinal health. Question 10. A veterinary nurse is assisting a veterinarian with a procedure involving a cat with a suspected foreign body obstruction in the gastrointestinal tract. The veterinarian recommends performing an abdominal radiograph. After obtaining the radiographs, the foreign body is not clearly visible. The veterinarian then suggests an abdominal ultrasound. What is the most likely reason the veterinarian wants to use ultrasound in this case? A. Ultrasound is better for identifying gas-filled objects in the gastrointestinal tract. B. Ultrasound can provide real-time imaging and assess the motility of the gastrointestinal tract. C. Radiographs are less sensitive for detecting foreign bodies, especially if the object is metal. D. The foreign body may be located outside the gastrointestinal tract and ultrasound can help assess other areas. Answer: B. Ultrasound can provide real-time imaging and assess the motility of the gastrointestinal tract. Explanation: ultrasound is effective in visualizing soft tissue structures and is often used to assess real-time gastrointestinal motility, which can help identify areas of obstruction or abnormal gas distribution. Option is incorrect because gas-filled objects can be difficult to visualize on ultrasound. Option C is incorrect because radiographs are generally effective in detecting foreign bodies, but the case may require further imaging to detect less obvious objects. Option D may be a consideration, but ultrasound is more useful here for assessing the gastrointestinal tract. Question 11. A veterinary nurse is assisting with a senior dog undergoing a pre-anesthetic assessment before a dental cleaning. The dog has a history of heart disease, including a murmur, and has been on medication for the condition. The dog's vital signs are within normal limits, but the nurse notices that the dog is panting heavily. What is the most appropriate action to take before anesthesia? A. Proceed with the anesthesia as planned, as panting is a common response to stress. B. Perform an electrocardiogram to monitor the heart function during anesthesia. C. Assess the dog's respiratory rate and breath sounds and consult with the veterinarian before proceeding. D. Increase the sedation dosage to calm the dog and prevent any signs of anxiety during the procedure. Answer: C. Assess the dog's respiratory rate and breath sounds and consult with the veterinarian before proceeding. Explanation: panting can be a sign of distress or respiratory issues, especially in dogs with underlying heart disease. Before proceeding with anesthesia, the veterinary nurse should perform thorough assessment, including respiratory evaluation, and consult the veterinarian for further guidance. Option is incorrect because panting could be a symptom of an underlying problem, and anesthesia should not proceed without evaluating the dog's health. Option B is good consideration, but the first step is to assess the respiratory system. Option D may exacerbate the issue, and increasing sedation without proper evaluation could be dangerous. Question 12. A veterinary nurse is asked to administer medications to a dog diagnosed with kennel cough. The dog is on a combination of antibiotics and cough suppressants. The nurse notices that the dog appears lethargic and has not been eating well for the last 24 hours. What is the most likely cause of the lethargy and poor appetite in this dog? A. The kennel cough is not responding to treatment and the dog may need stronger antibiotics. B. The dog is likely experiencing side effects from the prescribed medications, such as gastrointestinal upset or drowsiness. C. The dog is stressed from the hospitalization and needs additional calming medications. D. The dog may be dehydrated, which is causing the lethargy and lack of appetite. Answer: B. The dog is likely experiencing side effects from the prescribed medications such as gastrointestinal upset or drowsiness. Explanation: antibiotics and cough suppressants can cause side effects such as gastrointestinal upset, lethargy, and a reduced appetite. These side effects should be addressed by assessing the dog's condition and potentially modifying the medication regimen. Option is unlikely unless the dog is not improving after several days. Option C may contribute to stress, but it doesn't explain the medication-related symptoms. Option D is a possibility but should be considered alongside other potential side effects of the medication. Question 13. A veterinary nurse is preparing a 5-year-old mixed-breed dog for a routine dental cleaning. The dog has no known health conditions and has been anesthetized previously without complications. The nurse is conducting the pre-anesthetic assessment and notices that the dog has slight gingival inflammation and mild tartar buildup. What is the most appropriate course of action to take before the procedure? A. Proceed with the dental cleaning without any additional considerations, as the dog's oral health is generally good. B. Notify the veterinarian of the gingival inflammation to determine if any additional pre-treatment is necessary before anesthesia. C. Cancel the procedure, as even mild gingival inflammation could indicate significant underlying condition. D. Increase the dog's pre-anesthetic sedation to ensure the dog is completely relaxed before procedure. Answer: B. Notify the veterinarian of the gingival inflammation to determine if any additional pre-treatment is necessary before anesthesia. Explanation: gingival inflammation, even if mild, may indicate the beginning stages of periodontal disease or infection, which could complicate anesthesia. The veterinary nurse should notify the veterinarian to determine if additional pre-treatment, such as antibiotics or a more thorough oral exam, is necessary before proceeding with the dental cleaning. Option: It does not address the potential risk associated with gingival inflammation. Option C is unnecessary unless further concerns are identified. Option D could lead to excessive sedation without addressing the root cause of the oral health concern. Question 14. A veterinary nurse is caring for a rabbit that is recovering from a spay procedure. The rabbit is not eating or drinking post-operatively and is becoming increasingly lethargic. The nurse checks the rabbit's environment and finds it is quiet and dimly lit with no food or water provided. Weighs the most appropriate action for the nurse to take to encourage the rabbit to resume normal activity. A. Allow the rabbit to rest in quiet area until it recovers fully from the anesthesia. B. Provide fresh hay, water, and some leafy greens immediately to encourage eating and drinking. C. Administer pain medications to ensure the rabbit does not experience discomfort. D. Increase the temperature in the recovery area to help the rabbit feel more comfortable and active. Answer. B. Provide fresh hay, water, and some leafy greens immediately to encourage eating and drinking. Explanation. Post-operative anorexia and lethargy in rabbits can be caused by a lack of food and water or environmental factors that hinder their normal activity. Providing fresh hay and water as well as offering leafy greens will help stimulate the rabbit's appetite and encourage normal gastrointestinal motility. Option is insufficient since the rabbit needs to resume eating and drinking as soon as possible after anesthesia. Option C is important for pain management but should not delay encouraging the rabbit to eat and drink. Option D may be helpful in some cases but should not replace the immediate need for proper hydration and nutrition. Question 15. A veterinary nurse is tasked with administering a rabies vaccination to a 12-week-old kitten. The kitten has no known allergies, and the veterinarian has advised that the vaccine should be administered as part of its vaccination series. Which of the following is the most important information for the veterinary nurse to discuss with the kitten's owner prior to the vaccination? A. The kitten may experience mild side effects such as fever or lethargy after the vaccination, but this should resolve within few days. B. The kitten should avoid contact with other animals for 2 weeks after the vaccination to ensure immunity develops. C. The kitten should be monitored for an allergic reaction for 24 hours and the owner should report any signs of swelling or difficulty breathing. D. Rabies vaccinations are effective immediately. The kitten will be fully protected as soon as the vaccine is administered. Answer A. The kitten may experience mild side effects such as fever or lethargy after the vaccination, but this should resolve within a few days. Explanation. After receiving a vaccination, kittens may experience mild, temporary side effects, including fever and lethargy, which usually resolve within a few days. It is important to inform the owner about these common reactions so they are not alarmed. Option B is incorrect as there is no need to restrict the kitten's contact with other animals unless specifically advised by the veterinarian. Option C is good consideration, but allergic reactions are rare and typically occur within few hours, not 24 hours later. Option D is inaccurate because rabies vaccinations take time to become effective and provide full protection. Question 16. A veterinary nurse is asked to assist with a routine new to surgery on a 4-year-old male cat. The cat has a history of mild hypothyroidism, which is currently being managed with medication. The cat's vital signs are stable, but the nurse is concerned about the potential impact of the hypothyroidism on the anesthesia process. What is the best course of action for the nurse to take? A. Proceed with the surgery as planned, as mild hypothyroidism typically does not affect anesthesia. B. Consult the veterinarian to adjust the anesthesia protocol and monitor the cat's thyroid levels during the procedure. C. Discontinue the hypothyroid medication for 24 hours before the surgery to prevent interference with the anesthesia. D. Cancel the procedure until the cat's thyroid levels are fully normalized as hypothyroidism. Contraindication for anesthesia. Answer. B. Consult the veterinarian to adjust the anesthesia protocol and monitor the cat's thyroid levels during the procedure. Explanation. Hypothyroidism can affect the cardiovascular system, potentially making anesthesia more risky. The nurse should consult the veterinarian to determine if adjustments to the anesthesia protocol are needed, as well as ensuring the cat's thyroid levels are monitored during the procedure. Option is incorrect because even mild hypothyroidism can have an impact on anesthesia and precautions should be taken. Option C is not recommended because abrupt discontinuation of thyroid medication can cause instability in the cat's condition. Option D is excessive as mild hypothyroidism can often be managed during surgery with appropriate adjustments. Question 17. A veterinary nurse is assisting with A critical case in which a dog has been brought in after ingesting chocolate. The veterinarian has confirmed that the chocolate contains theobromine, a toxic substance to dogs, and the dog is showing signs of vomiting, diarrhea, and hyperactivity. What is the most important action for the veterinary nurse to take immediately? A. Administer activated charcoal to absorb the toxins and prevent further absorption. B. Administer intravenous fluids to stabilize the dog and ensure proper hydration. C. Wait for the veterinarian to prescribe the appropriate treatment and monitor the dog's vital signs. D. Attempt to induce vomiting using over-the-counter medications. Answer A. Administer activated charcoal to absorb the toxins and prevent further absorption. Explanation. The primary concern with chocolate toxicity in dogs is the absorption of theobromine. Administering activated charcoal can help absorb the toxin and reduce its further absorption into the system. Option B is also appropriate but should be done alongside activated charcoal administration to help with stabilization. Option C is not optimal, as the nurse should take immediate action to address the toxicity before the veterinarian prescribes further treatment. Option D is dangerous because inducing vomiting should only be done under veterinary supervision, and over-the-counter medications could pose additional risks. Question 18. A veterinary nurse is working with a team on a high-stress emergency case where a dog is brought in after being hit by a car. The dog has sustained multiple fractures and is in shock. What is the first priority for the veterinary team in stabilizing this dog? A. Administer pain medication and begin fracture stabilization immediately. B. Stabilize the dog's airway, breathing, and circulation (ABC) before addressing fractures or other injuries. C. Take radiographs to determine the extent of the fractures before administering any treatments. D. Perform full physical exam to assess the dog's overall condition before beginning treatment. Answer B. Stabilize the dog's airway, breathing, and circulation (ABC) before addressing fractures or other injuries. Explanation. In emergency cases like trauma, the primary concern is stabilizing the patient's airway, breathing, and circulation. Once the acts are managed, further treatment, including pain management and fracture stabilization, can proceed. Option is important but should not precede the stabilization of vital signs. Option C can be done after stabilizing the patient but should not delay the initial ABC management. Option D is important but is secondary to immediate stabilization in shock. Question 19. A veterinary nurse is assisting with a routine spay procedure on a 3-year-old female dog. The dog is healthy with no known medical conditions. During the procedure, the veterinarian observes some signs of internal bleeding. The nurse is asked to assist in controlling the bleeding. What is the most appropriate immediate action to take? A. Administer a dose of vitamin K to help with clotting. B. Apply direct pressure to the area of bleeding and inform the veterinarian. C. Increase the anesthetic depth to induce a more relaxed state in the dog. D. Attempt to suture the bleeding site while the veterinarian prepares other equipment. Answer B. Apply direct pressure to the area of bleeding and inform the veterinarian. Explanation. When internal bleeding is observed, it is critical to control it as quickly as possible to prevent further complications. Applying direct pressure to the bleeding site will help reduce blood flow and allow the veterinarian to address the situation. Option is not appropriate immediately, as vitamin K is typically used for anticoagulant toxicity rather than acute bleeding. Option C might not help in the situation and could worsen the bleeding. Option D could be premature, as it is up to the veterinarian to determine the appropriate surgical response. Question 20. A veterinary nurse is caring for a cat with a history of chronic kidney disease (CKD). The veterinarian has prescribed subcutaneous fluids to help manage the condition and support hydration. The nurse notices that the cat is becoming restless during the administration of fluids. What is the most likely cause of the cat's restlessness? A. The fluids are being administered too quickly, causing discomfort. B. The cat is anxious due to the procedure and may require additional sedation. C. The catheter is blocking, leading to improper fluid administration. D. The subcutaneous fluids are not the right treatment for the cat's kidney disease. Answer A. The fluids are being administered too quickly, causing discomfort. Explanation. When fluids are administered too quickly in a subcutaneous route, it can cause discomfort and swelling, leading to restlessness in the patient. The rate of administration should be slow to allow the cat to tolerate the procedure. Option B might be a possibility, but it's important to first assess the fluid administration. Option C is unlikely unless the catheter is visibly blocked. Option D is incorrect, as subcutaneous fluids are common and appropriate treatment for managing CKD in cats. Question 21. A veterinary nurse is asked to assist in performing an emergency cesarean section on a dog in labor. The dog's progress has been slow and it appears that one of the puppies is in distress. The nurse assists in preparing the surgical area. What is the most critical step the nurse must take before the cesarean section? A. Ensure the dog is fully anesthetized and stable before making any incisions. B. Administer an intravenous fluid bolus to address potential dehydration before the surgery. C. Prepare the necessary surgical instruments and ensure the sterile field is set up. D. Check the puppy's heart rate and respiratory status to evaluate the urgency of the situation. Answer A. Ensure the dog is fully anesthetized and stable before making any incisions. Explanation. Before performing a cesarean section, it is crucial to ensure that the dog is fully anesthetized and stable. An unstable animal could suffer complications during surgery. Option B is important for general stabilization, but should be done after ensuring the dog's anesthesia is properly managed. Option C is also vital, but should be secondary to the dog's stability. Option D may be necessary during the procedure, but it's more important to address the anesthesia and overall stabilization first. Question 22. A veterinary nurse is caring for a 7-year-old dog that has recently been diagnosed with diabetes mellitus. The dog has been started on insulin therapy. The nurse is tasked with educating the owner on how to administer insulin at home. What is the most important aspect of insulin administration the nurse should focus on during the education session? A. The insulin dose should be increased if the dog seems lethargic or loses weight. B. The dog's blood glucose levels should be monitored regularly to adjust insulin dosage. C. Insulin should only be administered after the dog has eaten a full meal. D. It is best to give insulin through the oral route for better absorption. Answer. B. The dog's blood glucose levels should be monitored regularly to adjust insulin dosage. Explanation. Regular monitoring of blood glucose levels is essential to ensure that the dog's insulin dosage is correct. The nurse should educate the owner on how to check these levels at home and adjust the insulin as needed under the veterinarian's guidance. Option is incorrect, as changes in behavior or weight should be addressed with the veterinarian rather than altering the insulin dosage. Option C is not strict requirement. The insulin can be administered with or without food, depending on the veterinarian's instructions. Option D is incorrect, as insulin is typically injected subcutaneously for proper absorption. Question 23. A veterinary nurse is assisting with a surgical procedure for a 2-year-old cat that has been diagnosed with a blocked urethra due to urinary stones. The cat is under anesthesia and the nurse is tasked with monitoring the vital signs. What is the most important vital sign for the nurse to monitor closely during this procedure? A. The cat's blood pressure, as urethral obstructions can lead to systemic effects. B. The heart rate, as anesthesia can have an impact on the cardiovascular system. C. The cat's temperature, as anesthesia can lead to hypothermia. D. The respiratory rate, to ensure that oxygenation remains optimal during the procedure. Answer. D. The respiratory rate, to ensure that oxygenation remains optimal during the procedure. Explanation. Monitoring the respiratory rate is crucial during anesthesia, as respiratory depression is a common side effect. Ensuring proper oxygenation will help prevent complications. Option is important but secondary to monitoring the respiratory system in this case. Option B is a consideration but should be monitored alongside the respiratory rate. Option C is valid, but temperature control is typically managed using heating pads or blankets and is less critical than monitoring respiration during the procedure. Question 24. A veterinary nurse is caring for a dog that was just diagnosed with parvovirus infection. The dog is receiving intravenous fluids and supportive care, but it is showing signs of dehydration, vomiting, and diarrhea. The nurse is concerned about the dog's ability to tolerate the current fluid regimen. What is the next best step the nurse should take? A. Increase the fluid rate to compensate for the continued vomiting and diarrhea. B. Monitor the dog's vital signs more frequently and consult the veterinarian if dehydration persists. C. Switch the dog's fluid therapy from intravenous to subcutaneous fluids to improve absorption. D. Administer antiemetic medications to control vomiting before continuing the fluids. Answer. B. Monitor the dog's vital signs more frequently and consult the veterinarian if dehydration persists. Explanation. Given the severity of dehydration and the dog's ongoing symptoms, it is essential to monitor vital signs closely and inform the veterinarian of any changes. This will help determine if adjustments are needed to the treatment plan. Option is not the best choice without consultation with the veterinarian, as overhydration could occur. Option C is not appropriate, as intravenous fluids are more effective in critical cases. Option D may be beneficial for managing vomiting but should not delay fluid therapy or monitoring. Question 25. A veterinary nurse is assisting with the care of a rabbit that has been diagnosed with gastrointestinal stasis. The rabbit is not eating or drinking and its abdomen appears slightly distended. What is the most appropriate treatment the nurse should initiate first? A. Administer subcutaneous fluids to address dehydration and support gastrointestinal motility. B. Provide a high-fiber diet to help stimulate gastrointestinal function. C. Administer pain relief to reduce discomfort associated with gastrointestinal stasis. D. Initiate an intravenous fluid line for immediate hydration. Answer A. Administer subcutaneous fluids to address dehydration and support gastrointestinal motility. Explanation: in cases of gastrointestinal stasis, dehydration is often a significant issue, and administering subcutaneous fluids is an effective first step in stabilizing the rabbit. Fluids help to hydrate and support the gastrointestinal tract. Option B is important but should be considered after addressing hydration and gastrointestinal motility. Option C is also important but should be secondary to providing fluids. Option D is not the first choice unless the rabbit is severely dehydrated and subcutaneous fluids are typically sufficient. Question 26. A veterinary nurse is assisting with the care of a cat undergoing chemotherapy for lymphoma. The cat has been eating poorly and losing weight. The veterinarian has recommended appetite stimulants to encourage the cat to eat. What is the most important aspect of monitoring the cat's health while on chemotherapy? A. Monitor for signs of infection, as chemotherapy can suppress the immune system. B. Closely monitor liver and kidney function, as chemotherapy can impact organ health. C. Track the cat's weight daily to ensure it is eating adequately. D. Monitor the cat's gastrointestinal health for any signs of nausea or vomiting. Answer A. Monitor for signs of infection, as chemotherapy can suppress the immune system. Explanation: chemotherapy suppresses the immune system, making the cat more susceptible to infections. It is critical to monitor for any signs of infection, such as fever, lethargy, or changes in behavior. Option B is also important, but monitoring for infection should take priority in this context. Option C is useful, but is not as critical as infection surveillance. Option D is also important, but infection is often a high risk during chemotherapy. Question 27. A veterinary nurse is caring for a 5-year-old boxer dog that has been diagnosed with hip dysplasia. The veterinarian has recommended a total hip replacement surgery. What should the nurse emphasize to the dog's owner post-operatively to ensure successful recovery? A. The dog should avoid all physical activity for several weeks to allow proper healing. B. The dog should undergo physical therapy to restore movement and prevent stiffness after surgery. C. The dog should be restricted to soft, padded bed for the first month following surgery. D. The dog should be kept in crate for the first 2 weeks to limit movement and prevent complications. Answer B. The dog should undergo physical therapy to restore movement and prevent stiffness after surgery. Explanation: after a total hip replacement surgery, physical therapy is crucial for restoring movement and preventing stiffness. Gentle exercises and rehabilitation help maintain joint mobility and strengthen muscles, leading to a faster and more effective recovery. Option A is not accurate, as complete inactivity can lead to muscle atrophy and other complications. Option C may be helpful, but physical therapy should still be incorporated. Option D can help initially, but prolonged confinement in a crate may impede recovery if not balanced with appropriate rehabilitation. Question 28. A veterinary nurse is assisting with the post-operative care of a dog that underwent an abdominal surgery to remove her foreign body. The veterinarian has prescribed antibiotics and pain management. The nurse observes that the dog is not eating, is lethargic, and has a fever. What is the most likely cause of these symptoms, and what should the nurse do next? A. The dog may have developed a surgical site infection, and the nurse should contact the veterinarian for further assessment and potential culture. B. The dog is likely experiencing a side effect of the pain medication, and the nurse should stop administering it immediately. C. The dog is likely dehydrated, and the nurse should administer fluids to address the symptoms. D. The dog's fever is likely due to stress, and the nurse should provide additional sedation to calm the dog down. Answer A. The dog may have developed a surgical site infection, and the nurse should contact the veterinarian for further assessment and potential culture. Explanation: A fever, lethargy, and lack of appetite are concerning signs of a potential surgical site infection. The nurse should immediately contact the veterinarian to assess the dog's condition further and consider taking culture to identify the source of the infection. Option B is unlikely to be the cause, as pain medications are typically well tolerated, and stopping them may worsen the dog's discomfort. Option C is important for hydration but does not directly address the potential infection. Option D is incorrect, as fever due to stress is unlikely and sedation could worsen the situation. Question 29. A veterinary nurse is caring for a geriatric cat with hypothyroidism. The cat is receiving medication to control its thyroid levels, but the nurse notices that the cat is showing signs of vomiting and diarrhea. What is the most likely cause of these symptoms and what is the best course of action? A. The cat may be experiencing side effects from the hypothyroid medication, and the nurse should contact the veterinarian to discuss alternative treatment options. B. The vomiting and diarrhea are unrelated to the hypothyroidism, and the nurse should address the gastrointestinal symptoms directly. C. The cat's hypothyroidism is worsening, and the medication should be increased immediately. D. The cat is likely dehydrated due to vomiting and diarrhea, and the nurse should initiate subcutaneous fluids. Answer A. The cat may be experiencing side effects from the hypothyroid medication, and the nurse should contact the veterinarian to discuss alternative treatment options. Explanation: vomiting and diarrhea can be common side effects of hypothyroid medications such as methimazole. The nurse should contact the veterinarian to discuss the possibility of switching to an alternative medication or adjusting the dose. Option B might be true in some cases, but it is more likely that the symptoms are a result of the medication. Option C is unlikely, as the medication is usually effective in controlling thyroid levels, and increasing the dose might worsen side effects. Option D is important but secondary to addressing the medication issue. Question 30. A veterinary nurse is preparing to administer a vaccination to a 6-month-old puppy. The puppy has received its initial round of vaccinations but has not yet completed the full vaccine schedule. The nurse should explain to the puppy's owner that the puppy is A. fully protected after receiving only the initial vaccines, B. at risk for exposure to some infectious diseases until the full vaccine schedule is completed, C. no longer contagious. Other animals after the initial vaccination, D. required to wait until the puppy is at least 1 year old before receiving any additional vaccines. Answer B. at risk for exposure to some infectious diseases until the full vaccine schedule is completed. Explanation: puppies require a full vaccine series to ensure full immunity against certain infectious diseases, and they are still at risk until the schedule is completed. Option is incorrect, because immunity is not complete until all doses are given. Option C is incorrect, as the puppy may still be contagious to other animals until the full vaccine schedule is completed. Option D is incorrect, as vaccines should be given according to the recommended schedule, typically starting at 8 weeks of age and continuing into the 2nd year.